Hello and a very warm welcome back to my channel. For some weeks now, we've been locked up inside our homes following social distancing and praying that we don't get coronavirus. We're washing our hands constantly. We're washing our fruits and vegetables and a packet of milk. We're sanitizing every surface we think might have the traces of the virus, and there is a process now to sanitize everything that comes from outside. Make sure everything from outside is clean, and it hasn't been easy for us. There's constant bombardment of news, the latest death toll or frightening statistics. All of this can have a serious impact on our mental health. Today we help you with ways to deal with the stress of this pandemic. Joining me now is a woman who has dedicated her life to helping people with their mental health needs, and she's making sure that the conversation around mental health is not just restricted to the hospitals. She works tirelessly with different communities like women and children who have been subjected to physical or sexual abuse, or for that matter the public transport drivers in Delhi, to make sure that they understand the need to create safe spaces for women. She's a wonderful psychologist and a woman I greatly admire. Monica Kumar, welcome.
Monica, thank you so much for taking the time out and talking to us. First of all, let me ask you this. How are you doing and, surviving the lockdown?
Yeah, these are tough times for all of us, I guess. And I think acceptance at situations, maybe there has to be a new normal now, and we have to be preparing for that. Yeah.
Okay, then. It is a difficult time for us, Monica, and the word uncertainty, our brain doesn't like that word. We want to be in control of our lives, and we are in a period of uncertainty. So let's start with the basic fear that people have right now of what if I contract the virus? And that fear constantly plays in their mind. What do you tell them? How should they be coping with this?
Yeah, I think the fear of unknown is tremendous right now, and the anxiety around it is very high. But when we say when we are anxious, we live it many times. We are constantly imagining, we are constantly being in that fearful situation. It is an unknown territory for all of us. So some amount of fear and anxiety is understandable. But there is a difference in being informed, and there is a difference of constantly engaging with the anxiety. And that's where we have to understand that, being informed is necessary, because this is the first time we all are experiencing. We need to know certain facts. We need to understand things are changing around the world. We understand that now this may be a new normal where periodic restrictions, active testing, physical distancing, safety standards, hygienes, all would be a way of life. But can we engage in it day in and day out? Can we be worried about it all the time? Can we be living it every minute? And I think that's where we have to understand and draw a line. That's one part. Second thing is, I think in this whole process, because it's like a crisis, right? So what happens in a crisis is that you are living that crisis. You're forgetting there is a normalcy around you. So it is very important to be kind to oneself, kind to people around, accept certain things, and then just be more loved. And be loving.
That's an important point you make about how we need to be kind to ourselves and be grateful for what we have, Monica.
Right.
But you spoke of not engaging with that anxiety. How does one do that?
I think one is that there is information available. So your source of information is very important. We need to know facts. It's happening around us. But if it is a WhatsApp gyan, if it is incorrect information, is more dangerous than lack of information. And if you are daily, every minute of your active, awake life, the thought is on your head, that means we are overdoing it. We are over imagining certain things. And anything unknown has this dimension where we can take it to another level. It's like you engage in fantasies, you engage in fears. So we need to be in control of your life. You need to set your time aside, that this is my information. I know what is happening. Now, what can I do to be in control of my life? I have already made safety standards in my house. My hygiene is fairly okay. I look after the things that, which is my personal space, my domestic space, my workspace. In that space, I have made it safe. Is there anything else I can do about it? If you cannot do anything else about it, living it day in and day out in your head is not going to help.
Right. Okay, Monica, then what about the people who are already suffering from some kind of a mental issue, be it any health related OCD or anxiety, depression, paranoia? All of that will be increased now in this situation. I'm sure that it is far more difficult for those people to be living in these times. What do you say to people who already have some of these issues that they're dealing with?
So it is a known fact, in abnormal situations we have extreme responses. So be it mental health or be it any other response, and people who have OCD, who are already imagining, and they're living a repetitive, intrusive thought in their head, the fears becomes more pronounced. So be it a fear of, most often what we see is that the fear of contamination to self or to the loved one is very high. And then along with it is a detrimental behavior of excessive hand washing, excessive cleaning, excessively trying to make disinfectants as a way of life. And then what happens is, while you are trying to work on this, there is also fear that I'm not completing the obsession. The completion of task is not there. So the fear, even if I wash my hands 10 times, maybe it is still dirty. Right? Yeah. So you are constantly worried about that you haven't completed the whole thing in a particular manner, and there is still a doubt in the head, which is very strong, that I'm not safe. The contamination is still very strong. So I think in that regard, it is very important that as somebody who is aware that I have a OCD, or somebody who is aware that I'm prone to anxiety, to discuss this with the loved ones in and around, to share that don't live it in your head alone, please. That's my first thing. I mean, talk about it to the people. They will understand. They will empathize with your situation. And if you're already on medication, I think it is important, if you think there is an increase in the symptoms or increase in compulsions, go and seek help from a psychiatrist. Visit your psychologist. All of us are available, and I'm sure whoever your psychologist is available on the online call. So do seek out help.
Let me tell all our viewers at this point that Monica is very busy these days. She's had back-to-back sessions. It's been difficult to get some time out from her, but which is fine, because right now people need you, Monica. These are difficult times for them.
In the lockdown period, one good thing which has happened is that people are reflecting. People are actually thinking, what is it that they want from their lives? How do they want to channelize their energy? So, having that space to yourself is equally important. And that's why, and we have more time.
Yeah.
They have time, the clients have time, we have more time. So it's easier to have a peaceful session.
Absolutely. And we have more time for ourselves, which is so important in dealing with your mental health issues, or making that better for you. Now, you talked of loved ones and the fear one might have, Monica. There's one thing that you feel afraid constantly of: what if I contract the virus? But then the other is the fear of one of your loved ones getting the disease. For a lot of people who are still not working from home, they have to step out for their work, be it the health workers or people who provide us essential services, policemen and women. There are so many people who are still going out there and working every day. And when they come back home, to deal with that guilt that I might have, or I might get the virus and then pass it on to one of my loved ones, how should they deal with this guilt?
I think one thing that we need to be appreciative of is the fact that our healthcare workers, our medical staff, the people who are cleaning, we need to be grateful for the work that they're doing. Let's remember that they have made a conscious choice.
Right.
to be there, and they know that what are the consequences of those choice, and they have chosen a bigger path than just making their surroundings safe, but making the whole whatever their space of work is also safe for others, right? So one is that they understand, they should understand that while they're responsible for others, they're responsible for themselves. And
Yeah.
what seems to be working is that they should shift the thought that I may be responsible for transferring the virus to my loved one, to the fact that I'm doing my best to prevent it from coming to my loved ones. For example, when I come back home, I change, I put my clothes outside. What all are the safety measures that I'm using outside and inside? How my loved ones are, are dealing with me. So conversations as well as practices, both if they are dealing with safety, I think that should be a great sense of encouragement to them than of a guilt.
Okay, so whatever guilt you have shifted to saying I'm doing everything to make sure that my loved ones don't get it. This
And
is also,
also, I'm shift the thought to that I'm doing best to prevent contracting the virus myself, and also preventing it from coming to my loved ones.
absolutely. The other being, we've all been confined to our homes, Monica. We're all practicing social distancing, but
Right,
for a lot of people who are living alone, they haven't
right,
had a face-to-face conversation in days. They're all
right,
stuck in their homes. They're all
right,
waiting for all of this to get over. But at the
right,
same time, I mean, there is this loneliness, that
right.
emotion of loneliness, not
Yeah.
being around people, that can be difficult at this moment. So how should they cope with a situation like this, and how should they cope with that emotion of loneliness?
A lot of people are talking about that instead of calling this social distancing, we should call it physical distancing.
Yeah.
Because physically we are away from each other, but socially we are connected. I'm connected to you right now. I'm connected to many like this. So are you. So one is not to feel that just because my physical space and physical interactions have been limited, my social interactions are also limited. Again, a shift in the thought and practices both, that what am I doing to engage or making that one call to people. I know my neighbor told me that she got a call from a very old friend of hers, and how important did it make her feel that that people are trying their best to connect with people they haven't connected for years.
Sure.
So one is that look for your social support systems, look for people who give you those positive vibes, look for encouraging spaces where you are able to share your stress and burnout. I know many who say that we are working overtime because we don't know what my job would be tomorrow, so it's important to have those conversation around it. The other flip side of this is that social media has become a way of comparisons.
Yeah. Oh,
how
yes.
many the physical activities are you putting in, how much are you putting the cooked food on the plate. Don't over engage with it. Don't let your self esteem be going away because somebody else is doing better than you. I
Yeah.
mean, so you need to also watch out.
Yeah, which is, I think, a problem that people generally face with social media, right? Because you always feel like someone
Yeah,
else's life is more interesting than yours. And I think that
yeah,
just gets more magnified in a situation like this, because there are people out there who are constantly putting all the things that they're doing at home, how they're
right,
keeping their children engaged while you are trying to just cook and clean the house and you have no time for your children. And talking about that, Monica, now children, I think they are, that they are the worst affected in a sense, because this is the age when we say children should go out and play in the park, they should hang out with their other friends, they should follow a routine, school being such an important part of
right,
their growing up years, but they are all confined, they're all stuck at home.
right.
What is it that parents can do to help children understand what is happening, but at the same time also make sure that they don't get worried about it? And how do they engage their children?
Yeah. See, they say that parenting is even tougher than running the country. So we anyway have a lot of doubts on parenting, and with the things which are available around us, we are constantly want to up the game in parenting. But understand that these are altered situations that we as adults are experiencing. So are our children.
Yeah.
They are confined, and they may have some behaviors which are wanting attention from you. They are their physical spaces have been taken away. They may be on the net more than necessary. You also need your computers because you're working on it. Your children need it because they need it for online gaming. So how much do you control and how much you let it be? So I think the battle here is, or the battle may not be the right word. I think the scores are more about balancing it.
Yeah.
There is no right and wrong about it. Sometimes they will overdo certain things. They will be more on the computers. Sometimes they may be more irritable. Sometimes they would want your attention. Sometimes they will be more clinging. Instead of criticizing them, instead of blaming them, instead of saying that this is not the apt behavior, understand that there is no right behavior right now. They need you. If you talk to them, if you distract them, if you engage with them, it is just a short span. Children have a very short memory.
Yeah.
Right? So they overcome that challenge and they move on to the next pleasurable activity. And you
Yeah.
engage with them on a more pleasurable manner rather than constantly complaining about them not doing the right and the best behavior.